So, hi everybody. I'm Karen, and this is our little sweetheart Tinks, and welcome to the PetsPage Show with Karen and Tinks on PetsPage TV. And my guest tonight is my very treat to have her here with me, Dr. Sue Ettinger, who is kind of known on the internet world, at least, as Dr. Sue Cancer Vet, and she is a board certified veterinary oncologist, and so she's here with us.
Yay!
Yay! Very excited to have her here. So she's actually a practicing oncologist at Animal Specialty Center, which is in New York, and she's the author of, or co-author of the Dog Cancer Survival Guide, which has all sorts of information in there. Should your pet be diagnosed with cancer, gives you kind of the wealth of information in there, and she also blogs about that, and she also has a segment on the radio pet lady.
Yep.
A little kind of a segment about a cancer vet segment on there, so some great information that she shares on there, and she's one of our veterinary specialists that we are honored to have on PetsPage.com. And kind of what we're going to talk about tonight is I have, many of you know, we've got an educational documentary that's going to air on public television, and we're trying to promote and get my message out there to create awareness about veterinary specialists, kind of such as Dr. Sue, Cancer Vet, and kind of what makes them different, and educating pet owners about it, and also encouraging general veterinarians to work together when needed, to work together with a specialist, kind of to ensure the best outcome for your pet, because oftentimes that, it is best to definitely kind of work together with a specialist. And so Dr. Sue is actually going to be one of the specialists that we're going to highlight on the educational documentary. And so the reason why I invited her to join us on there is because of the amazing stuff that she is doing. She is such a wonderful advocate for our pets' health, not only just being a veterinary oncologist, or even just being a veterinarian is awesome, and then being a veterinary oncologist, going to school for the additional 4 years beyond the general practice, beyond the general vet school, and where she did an internship and a 3-year residency, and she only treats and only sees cancer patients, and pets that have been diagnosed with cancer, to kind of help them along the way and give them treatment. So we're extremely excited that she's going to be on there and with us, and what she's going to be sharing is some guidelines that she's kind of come up with from all of that experience that she has, and she goes to tons of trainings and seminars and reads all the bulletins and the books and writes them and gives the lectures on them too, because she's definitely an expert for with cancer for our pets. And so the guidelines that she's come up with, it's called See Something, Do Something, kind of lumps and bumps. So if you would not mind right now, if we can just get a sneak peek and let everybody know, so they can go ahead and benefit from that information now.
So it's See Something, Do Something, and the idea is early detection. There are too many animals that we have lumps and bumps on them that may be malignant tumors, aggressive tumors. They could be benign masses, but we need to find out what they are. I can't go up to Tinks and feel a mass if he had one there and tell you what it is. You can't go, oh, well, it's squishy. I'm sure it's just a benign lipoma. We'll just move along. And so what we need to do is we need to be very proactive, and we need to aspirate. We do 2 aspirates or biopsies. So we need to stick needles in and take cells out of the mass and put them on slides and look at them under microscopes.
So that's a biopsy?
So an aspirate's
okay.
An aspirate is just a needle and syringe, just like you were going to get a blood sample, but we put it into the mass and draw back on it and put the slides. And that will usually tell us whether it's cancer or not cancer.
To get some of the cells,
some of the cells
that's in there. Just
some masses don't shed their cells well, and then you may need to, so we'll say, it was non-diagnostic. And then you'll go back and do a biopsy. But the problem is that when I was in vet school as well, we were told, well, what do you do with these? And the adage was, well, if it's getting bigger, if it's changing in size or appearance, we should do something. But no one's telling anyone. There aren't any guidelines for how big is too big. And so this all comes from a couple of cases that I saw very clustered together, and I got very depressed because they came in with masses like this big, on a cat face. And what And they were a low-grade cancer that if we had done surgery early, would have been curative. And so if we had done surgery when it was small, we get that normal rim of tissue called margins around it. Cat wouldn't have needed anything else. No chemo, no radiation. And now we did a CT scan. It was involving half of his face and his bones and things.
Because they had waited.
We had waited too long. And the owner just thought, well, it got bigger, so I came in, but no one told her how big. And this really stemmed from my nurse's dog. So Smokey is a pitty. He's no longer with us, but not due to cancer. But he was a pitty.
Too short.
Yes, of my nurse's. And over the years, I've aspirated many masses on him. She'd bring him in, Smokey'd look at me, and I would aspirate, and they were benign lipomas, fatty tumors. She brought him in one day. We were really busy. You know, I see a lot of cases. Oh, don't worry about it. Dr. Sue will just do it next week. I think a week or two went by, and he came in, and he was a white pitty, and he had a very large mass on his flank. Very large, like 9 centimeters. And so I aspirated it, thinking it was just going to be another lipoma, and I'm an oncologist, and I aspirated and blood came back, and I knew that wasn't normal.
Not a good sign.
The aspirate was non-diagnostic. We went and did a biopsy, and it was a malignant cancer. It was a low-grade one, but he needed a huge surgery that went down around his thigh to get margins. And we all kicked ourselves because we had waited because he had had so many lipomas. He probably had 10 lipomas over the years, but the 11th one was a malignant cancer and needed a very big surgery. And we all waited too long for that one. And that really is, so my guidelines are, if a mass has been there for a month and is a centimeter or bigger, which is about half an inch.
Okay.
And I plan to distribute calipers, little measuring devices, so people can keep track of their pets'
She's
tumors.
got a plan.
I have a plan. Then you need to go to your vet, and it needs to be aspirated or biopsied.
Okay.
If the aspirate is non-diagnostic or it's too small to even aspirate, just do a little punch biopsy. They can often be done with the pet awake with a little local anesthesia, so they don't even need a general anesthesia. But remember, even if it's malignant, a lot of these tumors, if we remove them early, that may be the pet all they need. So it could be curative, and we just need to find these tumors earlier.
And that's something with, I know we've talked about some of the different cancers and things, but with the malignant tumors, so if you do get rid of them at that early stage before it has a chance to kind of spread throughout the body, so it basically, is it just gone, or is there a chance of it coming back?
It depends on the tumor. So for Smokey, he had a low-grade soft tissue sarcoma, and those have about a 10 to 15% spread rate, and we don't typically recommend chemo. And that's a really good question, because people hear cancer and they think it's sort of one size fits all. And every cancer is a little bit different. Mast cell tumors, very common skin tumor in dogs. There are low-grade ones where surgery, again, may be all the pet needs. Some of them are higher, and 50 to 90% will spread. And so we may recommend chemotherapy. So we really tailor it to the pet. But, there are many tumors, even malignant cancers, that one surgery will be all that you need. But resist the temptation for a big mass to just lop it off, because chances are, if it's malignant, your pet's going to need a second surgery. So we really want to find out what it is, take a little piece of it first, find out what it is, and then plan that surgery really well.
So make sure that you kind of have, again, the lady with the plan. So that's wonderful. Well, so it sounds like that your message and the guidelines and specifically, what you're going to be sharing with the community on the educational documentary that's going to air on public television. Who's your target audience? Who are you trying to reach with this information?
Two groups.
Okay.
One is the pet owner. I want them to know two things. What is too big? So if your dog has a mass that's this big, that's too big, and you need to get to your vet and you need to get it aspirated. Our pets are fluffy. It's very hard to feel everything. But, when you're petting your pet, feel them for lumps and bumps and bring them to the vet and expect aspirates or biopsies. No one can go like this or look at it and say that's benign. You have to go the extra step and do the aspirate or biopsy. And my second target is the general practitioners. Not because they're doing a bad job, it's just that there aren't guidelines. And what I would like to do is help create guidelines so they know that, we should be doing aspirates and biopsies. The vets will expect it, and it's all for the pets. So we can diagnose their cancers early, do less treatment on them. We don't want to have to do second surgeries. We don't want to have to do radiation to prevent recurrence. We don't want chemotherapy. We want to save money for these pets by aspirating them early.
Yeah, and it sounds like a much higher chance of success.
Exactly.
A much higher chance of success when you do that. So, kind of what do you think, I'm excited that you're going to be sharing these guidelines on our kind of our awareness campaign that we're doing to increase awareness about veterinary specialists, and also to encourage general vets to work together with a specialist as a team to ensure the best outcome for your pets. So, what kind of it's the benefit that you see of sharing your message, the initiative and the guidelines that she just shared with us on a platform like this throughout public television, and also kind of where we're going to be promoting it with various public service announcements? How do you see that as being a benefit?
It's a benefit for the pets because we're diagnosing their cancer earlier, and hopefully they're going to have better outcomes. They can be, more curative, live longer, live well. And I want everyone to be involved. It takes a village. So it takes the pet owners, it takes the general vet. And then when you get that biopsy, if it is malignant, send it on to the oncologist so they can then tell the owner, well, do we need to do more? Were the margins wide enough? That's another problem that we see, is that it says the margins were clean, but they weren't wide enough based on the tumor type. And so there's a lot of information that you're going to get from the specialist that it's really important to make that extra step. So again, it takes a village to have our pets live longer and live well. So we want everyone to be on the same page.
Yeah. No, for sure, and that is actually the point of your guidelines. Well, so I did. That was my last official question, but something that you said, because I'm learning all of this. Whenever you have, so the general vet is actually the one that is going to do the aspirate and then and the biopsy, and they then typically how should that work?
So they should do the aspirate. If the aspirate, say it says mast cell tumor, they might do the surgery depending on the tumor, the size, the location, because now they know what it is, so they can plan. If it's a mast cell tumor, it's a malignant cancer, I need a big surgery. Oh, it's a benign cyst. We don't need a big surgery, just a little minor surgery. So
so the vet actually helps you then.
Right.
They're the ones that do that.
They make the diagnosis, and then once they find out what the cancer is, they can send it on to the oncologist.
She's been on a plane all day, so she's been.
I've been up for about 19 hours at this point.
Yeah. So definitely, but she is the lady with the plan, and we are extremely excited that she's going to be sharing that these guidelines, and it's just, she's the one that's kind of come up with this, and then wants to let the community, the pet lovers out there, the pet owners, and veterinarians kind of know specifically what you can do, and if you follow these specific guidelines, chances are that your pet's going to live longer and live well.
Well said,
Karen. Thank you again for being here with us, and if you have a story that you'd like to share with us, kind of maybe something about how a veterinary oncologist has been helpful with your pet, or something, a treatment that you had done, or maybe the advantages of whenever you did get a biopsy earlier for your pet, or maybe kind of things like that. If you have something that you'd like to share with us along that, we invite you to join us on PetsPage.com and look for the share icon and leave your stories there. And throughout the month of November, Tinks and I are actually going to be doing kind of a 30 days of giving thanks for our amazing pets and the awesome veterinary specialists who kind of help them to live longer and live well. So we're going to be selecting interviews from that list. So if you could just kind of let us know some details about what's going on there, you can send us a video if you like, and then we'll reach out for more information. And so if you could please make sure to share this video with your friends to kind of let them know everything that we've got going on and this important information here that Dr. Sue has shared with us. And so to find out more information about veterinary specialists, or to find a specialist in your area, please visit PetsPage.com. And thank you again, Dr. Sue. And Tinks and I will be back here with somebody else here next time. So thanks a lot. See y'all.